When the virus hit the United States, New York was hit first, and New York was hit hardest. There were local community members and community-based organizations connected to China, connected abroad, who were rapidly preparing for this, and their signals were missed. They were overlooked.
And a lot of times, if those, kind of basic social determinants of health needs aren't met, the other things are less in focus. And so that's a lot of the work as well, is really understanding, where is this hesitance coming from? Sometimes it's not an immediate hesitance to the vaccine itself. It's more about, I have other things that are happening in my life and that just feel like more of a priority to me now. And it's often providing the support so that they understand that they can be supported and that they will have that assistance, and that also the COVID-19 vaccine ultimately will protect them and protect their family and community.
We work with barbershop, with beauty salon, with nail salon, with clinic, with senior center, with daycare center, with supermarket, with places where you do not imagine that we are there, in the park, in the churches, diverse churches, everywhere, just to bring the word for people to know what we do on behalf of what we advocate for, which is hunger and also community healthy. That is important for us.
We can really lift up and amplify the voice of community members in the diverse neighborhoods of New York City. We can provide funding and a platform for organizations, as well as training and capacity building to help them grow and to be more successful in their mission. So it's really our goal to support organizations in their own mission and their own growth locally.
Queens alone is said to be the most ethnically and linguistically diverse urban area in the entire planet. So this is something that was intrinsically really important to us, was to partner with these community-based organizations that had trusted messengers that were from the community and could engage with these specific kind of groups of people.
For a community to be, to use immunization as a first step for them to continue being healthy. One community that is healthy, that definitely makes a difference. The vaccinated community is a healthy community. And that is the reason that we are here today, just to continue supporting each other and continue working.
New Yorkers come from everywhere, speak all different languages, and it really takes coalitions across cultures to have an impact and to be able to reach different people.
They used to come to get food pantry, and at the same time, they used to get the vaccine. So it was 2,000 people per Saturday. Could you imagine how much is that in a year? That is a lot of people. And that's the reason we partnered together to do this job.
In terms of building cross-cultural partnerships and lasting coalitions, it's really important to understand what administrative barriers may be present in terms of partnering with smaller community-based organizations and trying to alleviate and accommodate those barriers where it really is feasible. It's also really important to be flexible with kind of working on the programming so that they can really focus on the things that they do best, which is the connection with the community, having that cultural context, and therefore being able to really bolster the project because they ultimately have the trusted messengers.
Right now, there is a huge reform in the Medicaid program to make the social drivers of health more accessible, and services like food, transportation, and housing more accessible to community members so that they are better able to take care of their preventive healthcare needs.
And I think establishing that level of trust and connection is what's going to always be most important during a time of shifting public health guidance.
It's our vision to ensure that community-based organizations, which are the fabric of our neighborhoods, are our go-to for any public health initiative, the basis for any of our public health initiatives.
To continue working together as brothers and sisters, because as I say, one alone you cannot do it. people all together, we could accomplish.
We learned a hard lesson during COVID-19 by not listening and responding efficiently and effectively to messages that we were receiving from local communities. And it is our vision and mission and intention to ensure that we never miss those signals, those local signals again. And the best way to do that is to grow the capacity of these organizations and ensure their long-term viability and sustainability. The idea is for us to help a community group facilitate that conversation rather than facilitating it ourselves, because those are the trusted messengers for their community and are going to be able to best resonate and listen and understand and communicate. So we use a trusted messenger approach. We can support those trusted messengers with tools and training and assistance, but we're really there not to be the visible leader of the project, but the underlying support.
Understand our positioning, to understand the ways in which we can provide technical assistance and maybe capacity building, but also have kind of humility in terms of understanding how certain community-based organizations can bring a richer cultural, linguistic context to the table, and really having kind of that transparent, open communication to take all those elements and create the best project possible.
We believe that through the trusted messenger approach, by building sustainability of community-based organizations and ensuring that those signals are never disrupted, we can prevent future health disparities and catastrophes like we saw during COVID-19.